Welcome to Black Health, a talk show discussing medical issues impacting and afflicting the Black community. Now introducing our host, Dr. Michelle Kirwan.
Good afternoon and welcome to Black Health. I am Dr. Michelle Kirwan. I am the host of Black Health. I am a board-certified pediatrician and also the chief medical officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. And today I am pleased to have as our guest, Miss Kerry-Ann Royes.
Good afternoon. How are you, Michelle?
I'm good, Ms. Royes. How are you? Thank you for joining us today. We're excited. I'm very excited to talk about everything that you and YWCA have to offer. Before we jump into it, I'm going to give our audience a brief introduction to you, okay? So Ms. Royes is a mom, a businesswoman, an active volunteer who is passionate about education and social issues affecting women and girls. As CEO of YWCA South Florida, a nonprofit organization combining programming and advocacy to generate institutional change in three key areas: racial justice and civil rights, empowerment and economic advancement of women and girls, and health and safety of women and girls. Ms. Royes calls on her expertise in social justice and in innovation, strategic alliances, management, and leadership to carry out the organization's mission of rooting out social injustice and addressing all discrimination issues that happen at the intersection of race and gender. Her most recent successes at the helm of this 100-plus-year-old institution have included the rebrand of YWCA into a regional organization serving both Dade and Broward counties, the expansion of the board to include men for the first time, and the successful mobilization of their largest community-wide initiative, the Stand Against Racism Challenge. She's a native of Jamaica and has lived in South Florida for more than 30 years. She earned her bachelor's degree in psychology and sociology from FIU and an executive M.B.A. from Florida Atlantic University. She's a leader, strategist, and futurist at heart. I love that. Ms. Royes, very impressive resume, something of a tongue twister. Welcome.
Thanks, Dr. Kirwan. Thank you so much for having me. I'm really pleased to be here with you.
Great, wonderful. We're so happy to have you. So tell us a little bit about the YWCA South Florida.
You know, YWCA has been around for 100 years, and I think many people don't recognize that we're a social justice organization and sometimes get us confused with a swim and gym. Our YWCA has no pools and no gyms. We are only social justice. Everything that we have done to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all has been really centered in programs that address that intersectionality and the disparities that exist there. So we know that layering not just a woman, a person of color, but a woman of color with a disability, a transsexual person of color, all these intersectionalities create even deeper inequities, and we are always continuing to study and unveil those, one of which is the topic that we'll talk about today. So our programs span from early education, health, economic empowerment, safety programs, just the gamut to make sure that we are building our communities' response to social justice, but also addressing and working with those who have to live in the margins.
I'm glad you made that distinction between swim and gym and everything else that you just mentioned, because to be honest, for a long time, I was quite confused when I would hear about YWCA doing things like this. And my concept was in my head was always like a gym and you can go and work out there and so on. So I'm glad you've teased apart the difference between the two. What is the first but not the last Women's Award?
During our centennial, we launched this award, which is, named after the famous speech that our vice president made when she took the stage and said, "I am the first, but I will not be the last." And so that was the inception. At our centennial last year, we launched this award ceremony called First But Not the Last, Leaders of South Florida, Women Leaders of South Florida, which highlighted, celebrated, and inducted a group of women leaders especially in South Florida, who've broken the glass ceilings and made a way for all those who follow, right? Who have changed the dynamics of those spaces. So we've honored, for example, Madeline Pumariega from Miami-Dade College, the first Latina female president of that college. We had the first female president, CEO of a cruise line, Lisa Lutoff-Perlo from Celebrity Cruises, and several, Daniela Levine Cava, our mayor in Miami-Dade County, who was the first female mayor, and Juliette Roulac, who was with FPL and had many firsts as a juror, as a JD, a lawyer. So we have been able to really chart the course with amazing women who changed things. This year, we have our first Mankind Award, which will be going to the president of Broward College, who it has just changed the course of education, even for women and for girls and for our community. And we gave him the Mankind Award this year. And unfortunately, we had to postpone because of that fake storm that we had the other day.
Oh, okay.
The 24-hour fake storm landed right on our event day. So we had to postpone our event, and we will be sending out a new date very soon.
Okay, excellent. I think I have a suggestion for your Mankind Award for future. He has many firsts in medicine.
We would love that. Please
chat about that offline.
Yeah, whisper that in my ear, because it's funny, as we start doing this, we're now getting some really great suggestions. So we have names lined up for the future, and I love that. I love that people are really buying into and contributing to who they believe should be getting their flowers.
And I love how it connects the community, like one link to the next, link to the next.
Yeah, so great.
So tell me about
we're looking for the next.
Yeah, awesome. Tell me about the YWCA's Family Wellness Program, Breast and Cervical Cancer Screening Program.
So YWCA has been doing women and family wellness programs for a very long time. It's become a pillar in our community, and it's a leading program that fights against breast and cervical cancers. Within the program, we strive to decrease the mortality rates associated with breast and cervical cancers for women of color, by providing early access to screening and increasing the number of women that participate in regular screenings. We also provide health education and outreach, because we're finding that the propensity and the growth in mortality rates is really because of a lack of education, a lack of awareness, a lack of knowledge, a lack of early detection and screening. So to date, we have screened over 600 women and continue to grow that number. But we really want to make sure, especially coming out of COVID, a lot of women, including myself, so it doesn't matter how educated or how much education you have, or how much wealth or anything, how knowledgeable, how much access you have, a lot of us chose to put off our annual screenings. And that was because of the COVID situation. And therefore, a lot of women are finding themselves finding later stage issues than they would have had earlier stage issues. So we have a very urgent message right now to make sure that everyone's caught up on where they are.
And right before the show started, we were talking about breast cancer specifically in Black women. And although white women have higher rates of breast cancer, incidence of breast cancer, you were telling me, you can go ahead and tell the audience about Black women. Yeah.
So it's not that women of color are getting breast cancer at higher rates. It's that they're dying of breast cancer at higher rates, or detecting them at later stages, which then obviously contributes to the mortality rate. So the issue is there are culturally sensitive norms that are very much baked into this, but it's around health access, it's around early detection, and it's around that education. There are a lot of things that as Black women and women of color, it's just not the norm to talk about in your family. Did your grandmother have breast cancer? Did your mother have to deal with cervical cancer? What is your family history? It's never really been an open dialogue in our families. So when you couple that with the issue of underinsured or uninsured, underinsured or uninsured, as I mentioned, yes, as well as just late detection, a lack of education, then what we're finding is that the outcomes of detection are just much, much worse for women of color than for white women.
And to throw also in there fear, because I've heard of several women who develop a mass in their breast and it's getting larger or harder, or it's penetrating through the skin, and they're just, afraid, really afraid to conceive. Yeah, and so then again, you get that later detection.
Mm-hmm.
What specific medical screenings does your program offer?
So there are certain layers to the screenings. We do clinical breast exams, which are if you've been to your OBGYN and you have your regular external check for any lumps or anything that looks a little suspicious. So that's the clinical breast exam. If that healthcare provider then gives you a prescription for a further screening, you could get a screening mammogram or a diagnostic mammogram, depending on what they have found or what they would like to see happen. From there, there's ultrasounds that can take place if that mammogram reveals anything else. And then there could be rescreenings. Obviously, there are also Pap smears. However, what I would emphasize is that, I don't know, you might remember this, Dr. Kirwan, but when I was growing up, breast cancer was your grandma's disease. It was
Yes.
something that old women had.
Yes.
That
Absolutely.
you got a mammogram when you turned 50 or things of that age, that sentiment, right? That's no longer the case. And you might see this, and I have seen it everywhere. Breast cancer is prevalent in almost every age. And it's almost become where that age limit is no longer relevant. So,
Yeah.
yes, there is maybe a progression in later ages, but the truth is that it's not as age prevalent as it used to be. So now, if you detect something, there's certain indicators like a history in your family that may preclude you to needing to be screened differently. Your healthcare provider may not give you a regular prescription unless you're 40 and above, right? So our clinical screening is if you're younger, but you feel like you need to get tested, you feel like, you might have found a lump and you just need to get a screening, then we have partners who do that initial screening so you can get the prescription you need to get the mammogram. Most physicians, if you have a regular OBGYN or your primary, after a certain age, will write you your prescription every year. So if you have your prescription from your primary, you can bring it to us and we will connect you with a provider that will give you the mammogram. If you are younger and therefore you are not just getting your prescription, or you are uninsured and you don't have a prescription, we will connect you to a provider who will do the clinical exam and give you the prescription you need to get the mammogram.
I see. And so for uninsured patients, is there a cost associated with getting the mammogram? Can they get a screening and or a diagnostic mammogram as well as an ultrasound if necessary?
Yes. Thanks to our partners at the DeLuca Foundation, as well as United Way of Greater Miami, we have been able to offer these screenings absolutely for free. There is never a cost. So what we do is we have partnerships throughout the community with community health providers, healthcare systems, doctors individually as well. And they partner, they have a contract directly with us, and they give us low cost or no cost screenings. They might give us a certain bucket. We'll do the clinical test, we'll do the ultrasound, we'll give you 10 diagnostics for the year, we'll give you 10 ultrasounds for the year. And that relationship is what we navigate to plug women into the services that they need. So it's always free.
Wow. And about how many, do you have numbers as to about how many women you serve per month, per year, per member?
We have already screened about 600 women. And our goal is always to screen upwards of 200 to 300 women a year. So and then the education part of it is also very huge. It's also been a catalyst now to other kinds of programs that we know affect the women's health, which is their financial, their finances, their access to healthcare, their access to insurance, things of that nature. So it's We screen many women a year, but we try to educate many, many more. And that's become particularly challenging, which is why we appreciate platforms like this, because the face-to-face has been very challenging over the last few years. So platforms like this really help us to reach our target audience of women. And men, by the way. We have screened men.
You have screened men for
breast cancer.
Breast cancer. Okay.
Mm-hmm.
Wow.
Mm-hmm.
And have you found any men with breast cancer?
We have.
Wow.
It's a very few incidences, but we've had a few men who've called us because they felt something suspicious and they needed the screening. And sometimes you're embarrassed, right? You're a man. I can understand that. So coming to us is a little bit different than going to your neighborhood healthcare provider or something to that effect. And there was something detected and an early stage enough to be able to remove that.
Okay, so for our audience that is listening out there, men can get breast cancer. So if there's a man in your life with a suspicious lump or something like that in his breast, that should be checked. Thank you for bringing that.
Chest cancer. Maybe they'll latch on to it better if we call it chest cancer.
Chest cancer. Okay, so men can have chest cancer. Yes, men don't claim anything to do with breasts, right? So why is it important that the YWCA created this program?
First of all, I think what I mentioned earliest is that everything that we do is directly in response to a gender equity or race equity issue. And when we looked at the data around what was happening to women of color and the fact that there was such a disparity in the mortality rates of women of color, that's the reason why we do this work. We live in South Florida, first of all, where the immigrant population, the underinsured population, folks who work in the service industry and have entry-level jobs and therefore most times have insufficient insurance coverage, may have a language barrier, may not understand how to navigate the system, may have that kind of lab coat fear, right? May have folks in their family who are like, pray it away, or you are calling it into being, those kind of things. We know that this is a very relevant racial justice issue and that these health disparities exist, and that especially in South Florida, we need to help our community to educate and navigate. So these programs are critically important to our mission and very central to that work. We just continue to try to reach the hardest to reach areas and a lot of migrant populations. And, it requires a lot of trust building. So it's something that we have to keep a steady drumbeat and make sure that we're continuing to stay visible and in contact with those communities.
And you mentioned something that's often a barrier is language. Do you have people that speak Spanish, speak Creole?
Absolutely, yes. Okay. So our wonderful Alina, who is our client services coordinator, she is a Spanish speaker. We also have the opportunity for other translations in Creole, but we know that the relevance of our information being offered in multiple languages is critical. And the other barrier along with that is transportation. So we make sure that our partners are in hard to reach areas around the county so that folks don't have to travel very far from their homes to get the help that they need. And that transportation doesn't become a barrier or a reason, because it's a very real one. It's not just being able to get there. Yeah. It's a time away from work. It's, having to schedule it and non-schedule it. Can I get there in time to the bus? And there are a lot of complicated issues that surround that. So we try to mitigate all of those lived experience barriers that also come with the women and the target audiences that we're working with.
Who is the audience that you're trying to reach, and how are you reaching your audience?
So we are trying to reach under and uninsured women, especially women of color, and especially in areas and communities that are, as I said, hard to reach. So South Miami, some of our lower economic communities that struggle sometimes to get outside of their zip code to get the support that they need, or bringing that support into their communities. But it's all women in Dade and Broward counties who are under and uninsured, and pockets that are sometimes hard to connect with and hard to reach.
So they do need to actually live in Miami, in Dade or Broward counties, correct?
We target Dade and Broward counties, yes.
Okay. Okay. Um, is there a cost? No, we already talked about that. Sorry.
No
Cost for the
cost, free.
free. Yes, thank goodness. So when and where can someone get screened? Is there a program for a period of time, or is this ongoing? How long is this? Until
18
supplies
or over,
run out, or?
Supplies do not run out. And the reason I say that is because we have amazing funding partners. The DeLuca Foundation and United Way have been tremendous, to the point where if what they assigned us as funding, if there was an increased demand and we needed more, we could actually go back to our partners and say, hey, guess what? And I know that these partners in particular would try to support whatever additional funding was necessary to make sure that this happened. If you're 18 or older, on or underinsured, and you need any of these screenings, it is year round, it is ongoing. There is no beginning and end period. As a matter of fact, what we hope is that you come back year after year, so that you're always doing your screening and that you know that you have a trusted partner to get that done. So the program is ongoing. You simply have to reach out to us at ywcasouthflorida.org, or you can give us a call at, let me give you Deidre's number directly. Actually, it's 305-377-9922, or come on to any of our social media pages at YWCA South FL. That's YWCA South FL, or YWCASouthFlorida.org spelled out on our website.
Okay, excellent. Thank you for that information. From a non-clinical perspective, can you tell us what happens during the screening?
So, as I mentioned earlier, if you need an initial screening because you're under the age that get a regular prescription on an annual basis, say you have detected something, or you just feel that there is something odd going on and you want to get checked out, but you may not have a primary, then you could have a clinical screening, and that is not a mammogram. It's basically going to see a primary doctor or a OBGYN who would do an external examination of your breasts. And maybe if it's a cervical issue, maybe you would go in and have an exam as well, a clinical exam. At that point in time, if the physician feels that there is need for a mammogram or continued exploration of what could be continued testing, then they would give the prescription. And that prescription would then entitle you to whatever it is that the physician thinks is necessary. And then we would work with you at that point to remove any barriers to getting that secondary exam. Transportation, childcare needs, we try to work with you to do those things. That prescription will then connect you to getting a mammogram. That mammogram, most of us understand what mammograms are like. They're never fun, and they are cold. And yes, you get squished in a machine, and that's just part of how it works, right? But you can either have a screening mammogram, which is kind of what you have annually if you're a woman over 40. And if that screening mammogram then detects something more that needs more examination, you could go on to a diagnostic mammogram, which is much more specific. Again, we help you to navigate that to make sure that you have everything that you need. And if there's even need for further treatment, we help you to navigate and assist you with finding the right providers to make sure that that happens, whether it is like, having there's a word I'm looking for, Dr. Kirwan, when you have to take a sample. Biopsy.
Yes, I was just going to say biopsy. Yes.
So
is the biopsy then also free, or
right now talking about right? What we've done is, because our work is generally in the beginning phases and making sure that you get to that detection phase and kind of going through some of the more intense screenings, we have created relationships with providers who can then plug you into healthcare. So local clinics who can get you into Medicare, Medicaid, or other programs that they may have, so that you're now getting into a more rhythmic pattern of getting your screenings, your blood work, and so on, and also getting the medical treatment that you need. but the coverage rather, I'm sorry, the coverage that you would need then to maybe do a diagnostic or do a biopsy. So those, now that we have those partners, we pipeline you to those partners who would then help you to get the deeper treatment that you might need.
Yes, yes. And I imagine insurance is probably much more necessary for biopsy, because now you're talking about getting to something that's quite expensive.
Yeah.
And the ultrasound, I don't know for the audience, if you've not had an ultrasound, something very simple, not painful like the mammogram, laying
Right.
down, they put some, it can be cold, a little cold jelly that they put on, and then they just run it over the breast to detect any masses as well. So that's the ultrasound. And the cervical cancer screen, what does that entail?
Well, as non-medically as I could say it, it would entail a Pap smear, which is usually the earliest detection to see any abnormal cells. And if something comes back from that, which Pap smears are included in our treatment process or in our screening processes, if something comes back from there, then again, we help you to navigate with a healthcare provider that could do some more diagnostic testing. Or if you, again, need to do a biopsy or some further deeper testing, that you have the right support and healthcare coverage to be able to manage that. And we walk alongside you in that process as much as possible.
Perfect. And as many know, human papillomavirus is one of the viruses that leads to cervical cancer. It is a sexually transmitted virus, and there are vaccines for it, the HPV vaccine. So,
and it is for boys and girls.
It is for boys and girls starting at the age of 11. So we highly recommend that. That's our first line of defense, actually, is that vaccine. But then we still do Pap smears and look for those cervical cancer cells.
100%. And thank you for saying that. And I will tell you, my children have gotten this human papillomavirus vaccine. And I hesitated at first, right? Because I think a lot of mothers, when you look at your 12-year-old, you don't want to think about a sexually transmitted disease. And you start to think, well, they don't need that. They're not, sexually transmitted. Oh, come on. And there has to be a level of education done around that to make sure people understand that it is preventive, so that when they are teenagers, off to college, young adults, that they are and living a healthy lifestyle that may not be by any stretch of the imagination any riskier than anybody else, that they would be protected.
Absolutely. The way I explain it to parents that come in who say the same thing, my child is 11, what do you mean a virus that is transmitted sexually? But I tell them we want to have them fully protected prior to any potential sexual activity. And quite often the parents are the last person to be aware that the child is sexually active, maybe when they're a teenager or a young adult or what have you. The parents are not going to know. So we just encourage to do this prior to, so that we just know it's out, it's done, it's out of the way. And, they have that protection.
Agreed. Agreed.
Yeah, excellent. So, Ms. Rice, I'd like for you to give one more time the information on how the audience can get more information about your program, your phone number and website and so on. One more time.
Absolutely. So you can reach us. You can even Google us, YWCA South Florida. Make sure it's the W that makes the difference. Don't forget that. YWCASouthFlorida.org is our website. On any social media platform. Well, maybe not TikTok. We're going to get there. On any social media platform, you can reach us at YWCA South FL. That's YWCA South FL. So, and you can click the link in any of those bios and get to our website. And you can give us a call at 954-334-9922. And we would be happy to get you to our family wellness and women's health office to help you to navigate this opportunity and to stay a step ahead of your feminine and gender specific health.
Excellent. So we do have a question from a viewer. Miss Arlena Williams is asking, does the HPV vaccine require more than one dose? So I will go ahead and answer that as a pediatrician. I can say yes, that it does require either 2 or 3 doses, depending on the age that you start the vaccine. The youngest you can get it is at 11. And if you complete it by 15, it's 2 doses. Afterwards, it'll be 3 doses. And I believe it still goes up to the age of 26. I'm a pediatrician, so once you hit 21, you're out the door from me. So your next provider is responsible for your HPV vaccine. But last I know, it went up to the age of 26. So, and Pap smears, we start at the age of 21. Most people think, or quite often people are thinking that once a child or a young adult, young teenager becomes sexually active, that they need a Pap smear. That's actually not true. We actually don't start doing Pap smears until the age of 21. And they're done yearly, or depending on the type of Pap smear that you have, you could maybe do it every 3 years. So a little bit about HPV vaccine and Pap smears and cervical cancer. Thank you so much, Ms. Royce, for this information. Very valuable and absolutely life-saving information that and work that you all are doing. And I can guarantee you like 100% that we definitely have uninsured patients that need mammograms, and we will be referring them to you from the Pediatric and Family Health Wellness Center. Yes, because it's a struggle for providers when you're faced with a patient who doesn't have insurance and they need a colon cancer screen, they need a Pap smear, they need a mammogram. It's not one screen that they need. And when you're talking about somebody who's uninsured and potentially, living in an underserved area, low income family, they can't afford all of these screens. So it's very important that we have these in the community for free for our populations, and that because these things are preventable. We don't have to die from breast cancer, cervical cancer. There's prevention, and then there's testing. And if it's free, we have to take advantage of that. So again, thank you so much. Do you have any parting words for the audience?
I just want to say thank you so much for having me, Dr. Kirwan, and also to Legacy for having this program, which I think is just so incredibly relevant for our communities. As I mentioned before, we have these social norms, we have these cultural norms about not talking about things or not sharing things openly in our families, and we have to break those norms down. And these are ways that we create pipelines to do that. So I think this is an incredibly relevant platform, and there are just so many disparate issues that are surrounding people of color that we have to continue these conversations and help not only patients and clients and people and our neighbors to navigate their own health, but also our healthcare providers to understand their implicit biases that are built into these systems, so that they themselves can, without blame, recognize that they can change that. So I just appreciate the platform.
There's a quote from your bio that I'm just going to read. Now more than ever, I am inspired to see more businesses courageous, passionate, committed, motivated to build equity and move equality forward to continue eliminating racism and empowering women. And that is what the YWCA is doing. So thank you for all that you are doing at the helm of that organization. Thank you to our audience for tuning in today. And a thank you to our sponsor. Black Health is brought to you by FAMU Medical Marijuana Education and Research Institute. Get credible information and engage in a safe space to learn and talk about cannabis. Educate, learn, and talk about cannabis in Florida. FAMU Medical Marijuana Education and Research Institute. Thank you again, Ms. Royce, for joining us. Thank you to you out there in our audience that join us weekly. We appreciate, and we ask you to send in ideas for topics or anything that you might want to hear about. We appreciate your feedback. Have a great day, everybody, and thank you again.
Take care. Bye-bye.